and she wanted to know if I would consult with a case they have that they had been working with for years and were getting absolutely nowhere, and it was impossible. And I said, well, tell me a little bit about the case. And she said, well, there's a father, and that he is a veteran of the Vietnam War. He's receiving from the government 65% disability for wounds and things received in the war. He's also being treated by the Veterans Administration Hospital. The Veterans Administration is a hospital set up to work with veterans with their physical and mental problems, the veterans of the military service. And they're treating him there for alcoholism because he's a serious drinker. They're also treating him for drug abuse because he uses he shoots heroin and mainlines it. And they're also treating him in the psychiatry department for what is variously diagnosed as borderline and sometimes as schizophrenia. And he's also being seen by what they call the Vietnam counselors. This is a group of peer counselors that work with some of the special problems of the Vietnam veterans who are in our country sometimes having a difficult time because here they were sent off to this horrible war, and there was all of this dispute in the country as to whether we should be there or not, and they feel very abandoned and used, and they have very special feelings about this. And so they have the Vietnam counselors who work with those people, peer counselors. So he's getting a bundle of treatment. You know, these people are different than these people, are different from these people, are different from these people. And then in addition to that, the protective service people, the social workers, are hot into it because he's also accused of physically abusing the children and abandoning them, neglecting them, and other such things. I said, fine, tell me about the mother. And they said, the mother is not too swift. Not too swift. That's kind of a jargon referring to the fact that they don't think she's very bright. Not too swift of mind, not too bright. And I said, what about children? They said there are 4 children. There's a 17-year-old male, and he's been treated actively in the local child guidance clinic for what had been diagnosed as autism. They're changing the diagnosis to childhood schizophrenia, and they're in the process of transferring him because of his age from the child unit to the adult unit. And he'd been in treatment for some years. Been treated with psychotherapy, Thorazine, institutional placement, the usual. And not doing too good. He's also in special education classes because of his psychosis. They asked, and then asked about the next one, and it's a young girl. She's, I think, 14. She's also diagnosed as autistic and is in special education, has also been treated with Thorazine and psychotherapy and in special education and in neuro treatment for the autism. She does very little but play air music all day, like that. And also is a terrible education problem because she tends to steal the food out of the garbage cans and such things, and is difficult to manage in the educational system. The next child is, I think, 11 or 12, a boy, and he is a major school problem, very difficult to manage. Is in special education, and they can't control him in classroom, and he's a major discipline problem for the school, and they keep him in social isolation for most of the time. He's that difficult to manage. He also is in need of some surgery. He has a game leg from a birth injury, and the surgeons want to operate on his leg, but somehow or another the family can't get organized to get it done. The social workers are involved with all of these kids because they're afraid of physical and sexual abuse from the father, and the nuns in the school where these kids go to are afraid that these kids are having sibling incest. All 3 of these children were born by were fathered by different males that the mother can't remember. Her father was a career Army sergeant, and she traveled a lot and drank a lot and was very difficult herself to manage, and she got pregnant on 3 different occasions by men at a drunken party that she doesn't remember. There's a 4th child, a young boy who's about 7, and is also a school problem, is in special education, and is also deaf from repeated untreated ear infections. Another thing the social workers are very alarmed about, because they see that as part of the neglect and the lack of adequate parenting coming from these people and not taking care of the obvious physical needs of these children. These people have been married for 11 years, so this kid is 12. They've been married 11 years. And in that entire time, all of these problems have been treated by an army of professionals. I took a count one time, and at this particular time, I think there were 40 to 50 different professionals involved in trying to manage and work with and treat this family. The special counselors, the special education teachers, the social workers, the mental health workers, the surgeons, the ear doctors, etc. It's just a tremendous number of people. What would you do with this family?
Fix it.
Fix it. If you ever want to get modest about your capacity to fix anybody, this will make you modest. What would you say to the social worker? I said, sure, I'll see them. And I did that for 2 reasons. And one, she was a friend. Now, a lot of times in clinics and hospitals, you get people that are referred because they're being dumped, right? You all, those of you that work in inpatient units know that real well. People get tired of working with somebody, so they refer them because you have the expertise of the institutional management. We call that dumping. But I knew that this was a friend and she wouldn't do this to me. These are very important issues. And I also knew that as a friend that she wouldn't make this referral if she didn't have some sense that something could be done. Now, these people, they've had the kids taken away, they've been in institutions, they've all come back. It's been a mess for years. But for some reason or other, she thought this would be helpful. So I appreciate that kind of optimism. And it means a lot to me. Secondly, I was very impressed with the fact that these people have been married for 11 years. Stayed together for 11 years, despite the drinking, the alcohol, the abuse, the social workers, the professionals, and God knows who else these people have come in. If I had this many people in my life for 11 years, I'd have committed suicide by now. And this case brings up some issues that we can get to talk about, some of the differences between social control and treatment, and the difficulty in understanding that mandate that we get into, mandated by the institution we work for. Most of the mental health treatment, mandated mental health treatment, represents social control, not treatment. And so social control issues are big ones here. I was also very impressed with a couple of other things. I was impressed with the fact that the mother was described as not too swift, almost dismissed as a non-entity. And the father was described as an angry, almost impossible person to work with. Dangerous even. The word dangerous was used to describe him. And that impressed me. And the fact that despite major disability and dysfunction, these kids nonetheless were back home. That impressed me. In many families, these kids would have been in institutions and lost by now. And I didn't understand how any of that could have happened. So I said to the social worker, yes, I'd be glad to see these people, provided you will get as many of the different professionals that are working with this family to observe the interview on one-way television. So remember, my thoughts of a problem system is it's not just these people here. It's these people and everybody else that's in communicative contact about the problem. So I've got a problem system here of 50 or 60 people. And somehow the entire problem system has got to change its way of thinking, its way of being in language about what the problem is. Because the one thing I know for sure, whatever it is they're doing now simply isn't working. And something different needs to be done. Which means we've got to language about it differently, we've got to understand it differently, we've got to think about it differently, we've got to talk about it differently. And the only way I can do that, you can't tell 60 professionals, come on into psychotherapy. But you can influence the way they language, understand, and talk about the problem. And I pick this way. I saw the family in one room, and they're in another room watching. And that gives me an option. I can produce, and this is an interesting thing in an interview, it relates to the research that you talked about in terms of teaching people how to talk. You can actually make an interview come out any way you want to. I can talk with somebody and make them crazy, I can talk with somebody and make them non-crazy. By the questions I ask, by what I talk about, by how I talk about it, by what I respond to, by my response to their response. You can make a family come out to be anything you want it to be. We do that by the theories we have. It's not surprising that any time a Freudian analyst sees somebody, they discover an Oedipus. I never do. It's not surprising that any time a Minuchin family therapist interviews a family, they see a family with a generational violation. I never do. Now, are those things in the family, or they're in our ways of talking about the family? Is the family that exists in our theory? Or is the family that's in the mother's head, that's in the father's head, that's in the kid's head? Or is it none of those things? Which family are you going to work with? And I need to find a way of working with this family, whatever they may be, that is a different family than the one these people know. Because the family these people know is impossible to work with. That's the challenge of this interview. Does that make sense? If I just interviewed this family and produced an impossible drunken father, a not too swift mother, and some very disturbed kids, we would be exactly where we started. By the very questions we ask, we produce the answers that we get. We are as much responsible for manufacturing the pathology that we see as the people we talk to. We are not microscopes that observe people. We interactively create the realities we work with. Always. So, the family is in the room with all of this. And I think most people would agree this is a difficult family, wouldn't you? Most people would. And we've got the family sitting down in a kind of a semicircle because it's going to be videotaped, and we wanted to get a good videotape. And I'm sitting here, and the only reason I'm sitting there is because there's a special microphone there. I tend to talk softly, and they want to make sure the sound is picked up. And so they have a special microphone there that I can wear. Otherwise, I don't like therapy rooms that are